but we're here to talk about dentistry today. What happens in your mouth affects the rest of your body, and how is that so? We know, for example, that smokers are much more likely to develop gum disease. Why is that? Because smoking compromises our immune system, the way that we fight disease. We know that gum disease significantly improves when we quit smoking. People at Harvard who did research found that one of the most important contributing factors to our longevity, to how long we live, to the quality of our life, as well as the quantity of our life, was daily flossing. Because we remove bacteria from our mouth. The mouth is a very dirty place. We have lots of bacteria that goes on in there all the time, and we're producing more all the time. That plaque bacteria, the bacteria from our teeth, from our mouth, from our gums, it's linked to lung infections in people with chronic lung disease. It's linked to a weakened immune system that slows our wound healing. And for pregnant women, it creates a higher risk of premature and preterm and low birth weight babies. So the things that are going on in your mouth have a direct effect with some of those other areas. One of the reasons that we know that, one of the most exciting changes that's happened in the theory behind healthcare, behind medicine in the last number of years, since before I went to school, this is all relatively new, is that the way that we see disease, the way that we view the disease's progress in the body, the way that we see the body fighting that disease has changed. We used to think, and some of you in here are my age, we used to think that when we got sick, we took an antibiotic, if we had a bacterial infection, and that took care of it. One of the things that we've learned is that the way that the body fights the disease by producing antibodies, the way that the body fights the disease through its inflammatory response, when you get infected, when you get a cut and you get that redness, that's the inflammatory response showing. That response, in turn, causes disease. And that's something that's very new. Most people still operate under the assumption that when they get sick, they can take a drug for something, and that the drug will fight the disease. Increasingly, the drugs that we are taking, the drugs that we are prescribing, are related to reducing our body's ability and predilection to fight the disease, because in fighting the disease, we are finding that our body is creating as many problems as the disease itself. And this is a very new concept for us. So that host, that body's inflammatory response, is a significant contributor to the disease process. Let's talk about diabetes and our heart and the mouth. We know that uncontrolled diabetes can affect multiple body systems. And I've listed some of those here for you. Not just the heart, not just the kidneys. We know that it affects the eyes, the nerves, and we know, if we're familiar with people who have diabetes, that it affects their body's ability to fight wounds, to heal, to improve their body's ability to get better. When you have diabetes, your mouth is affected the same way. You have a reduced blood supply in the mouth. You have tissue breakdown in the mouth. You have a higher likelihood of getting an infection, and your body's ability to heal is directly affected. So when you have diabetes, it's not just the major organ systems that we think of, heart, kidneys, eyes, nerves, etc. It's also the mouth. And what happens is that when we have people who have diabetes who may not be aware that they have diabetes, and they come in to see the dentist and they have periodontal disease, gum disease, maybe they have bone loss, maybe they have gum inflammation, maybe they have bleeding going on, those things can be monitored, picked up, and referrals made. So the relationship between diabetes and periodontal disease is a very strong one. The reason that diabetes affects the mouth is because diabetes is a blood sugar metabolism disease. And that increased blood sugar, the body's ability not to metabolize that blood sugar, the body's increase in the blood sugar, the amount of sugar in the blood, changes the way that the tissue structures work, changes the way that your tissue functions, the bone and the soft tissue around your teeth, and it becomes more likely, it has a higher likelihood, an increased response to any type of infection or inflammation. So when you're told to brush your teeth, when you're told to floss, the reason is because you're trying to remove bacteria in your mouth. The plaque functions as a way to produce bacteria, and that inflames the tissues in your mouth, and that tissue response doesn't work as well when you have diabetes. So you get more inflammation, the tissue breaks down more easily, and your body becomes more susceptible to infection. When you have that chronic gum disease, your body will be in a chronic inflammatory state, and in that state your body circulates toxins. You reduce your ability to have the insulin work the way you want it to, and you have a further risk of increased diabetic complications. So having periodontal disease when you have active diabetes improves the way the diabetes works, and it makes your body function at a lower health level. Because at the end of the day, the diabetes impairs, creates a problem for the way that the diabetes is functioning or the way that the insulin and the blood sugar functions in your body. So by improving the diabetic control, we know through the research that periodontal disease is improved. We know that by improving periodontal disease that we have a higher likelihood of improving diabetes. The two are related. They work together hand in hand. And when someone has active diabetes and they control their periodontal disease, and I've listed some of the ways we do that, deep cleanings, local antibiotics, systemic antibiotics, there are different ways to do that. By controlling periodontal disease, diabetes can be improved, your diabetic condition can be improved, and we know that the amount of insulin that you need is reduced and your blood sugar is lower. So all of these things tend to work together. Disease states are not separate and independent. Our body is not a series of discrete systems. Our body works all together, and when one thing is not working, other things are not. In this case, as an example, periodontal disease and diabetes go hand in hand. Let's talk momentarily about the heart. Most people these days have read enough to understand that when there is bacteria in the bloodstream, the heart gets at risk. For those of you that follow football, we have a classic example of that. The head coach for the St. Louis Rams has stepped aside for a while he gets his heart infection under control. And it's been reported that he is suffering from bacterial endocarditis. Bacterial endocarditis is simply a fancy term that means that he has bacteria that's entered his bloodstream and gone into his heart. Most of you can sit here and imagine that if you have gum disease in your mouth, if there is breakdown in the tissue structure of your mouth, that bacteria will easily get from your mouth into your bloodstream, and that contributes to heart disease and an increased risk of heart attack. One of the terms that's been in the news media lately over the last year or so is CRP, C-reactive protein. There's been some discussion that you may have read about that talks about whether cholesterol is a factor or now is C-reactive protein a factor. What we do know, and what's important for you to understand, is that when you have bacteria in your bloodstream, that increases the body's inflammatory response. What I said earlier was that one of the changes that we've learned about, one of the things that's different about how we see the body's mechanisms working in the last 25 years, is that when the body has an inflammation, when it has a stimulus, when something is causing it to react in some way, that the body's stimulus creates an inflammatory response to try and fight that stimulus, and that inflammatory response can create as many problems for us as the disease itself, the disease that may have caused the initial stimulus. So now not only do we have to fight the disease process, we also have to fight our own body's process, which is trying to fight the disease process as well. And one of the reasons that for many years people didn't get as well as quickly as we wanted them to was because we didn't understand that. Now we're beginning to understand that, and people are developing drugs that go that way. C-reactive protein is an outgrowth of that disease theory, that understanding of how we get sick and get healthy, an outgrowth of that process. So when we get sick, when bacteria enters our bloodstream, the heart is trying to fight this, the body is trying to fight this, C-reactive protein goes up. C-reactive protein inflames the walls of our blood vessels. It can cause blood clots that, of course, as we all know, can lead to heart attack and stroke. And we know that people with heart disease and people with gum disease have an increased risk of heart attacks because of the presence in their bloodstream of all of this bacteria. So one of the things that we're trying to do is to help people improve the health of their mouth so that they improve their overall health. Because when their mouth is healthy, they have an increased likelihood of having less problems floating around in their body. And that amount of less problems is directly correlated to the amount of health that they have in their mouth. The more infected the gums are, the more problems there are. When you answer, yes, my gums bleed when I brush, no, I don't floss very much, the problems that leads to can create these other problems. And what these other problems mean is that the body will respond to it. Bacteria in the bloodstream is a stimulus. It creates issues for the body to try and fight off. The process of fighting that off creates other problems, and that leads to more disease breakdown. So what we're trying to do is to help you create a steady state environment, something where you're healthy and you're at a higher health level than you would be otherwise. I gave you a slide on C-reactive protein just so you'd understand that a little bit better. They're a substance that has been found to be produced in the liver, and generally, as you can see, anytime you have some sort of stimulus, as I said, the body is going to produce C-reactive protein. The more stimulus that you have, the more issues that are going on in your body, the more C-reactive protein that's going to be produced. And we know that it's the increased CRP, the increased C-reactive protein, that enhances this inflammatory response. And once again, the increase in that inflammatory response is what causes our body to react and to create just as many problems as the original disease stimulus itself. So CRP is binding to proteins in the arterial plaque, the substances that adhere to the sides of our blood vessel walls and that begin to narrow them. When you hear people talking about blockages, you're talking about the types of things that have to be removed that are created by this plaque. You get the local inflammatory production, and we know that creates the problem in and of itself. What does CRP mean in terms of the mouth? There's a direct correlation between CRP, C-reactive protein, and periodontal disease. So not only do we look for periodontal disease in the mouth and the causes of that periodontal disease as mouth issues, but we also know that there are systemic body blood-borne issues that are contributing to that. We know, for example, that attachment loss, one of the things, and I apologize if you know this, but let me just repeat it for those who don't. What some people don't understand is that the tooth is like a castle and it's surrounded by a moat. And the depth of that moat is a measurement of health. So when you go to your dentist and they're measuring your periodontal pockets, they're measuring to see how deep that moat is, because the area around that tooth, if you think of an old English castle, is like a moat. The deeper that is, the harder it is for us at home to keep it clean. The shallower it is, the easier it is. The deeper it is, the more likely there will be disease. What I've told you here on this slide is that for attachment loss, for places where the moat is deeper, that there is a direct correlation with the amount of CRP, of C-reactive protein, that the liver has released into your bloodstream. And so our goal as dental professionals is to help you understand how and to be successful at making sure that the periodontal disease in your mouth is under control, that your gums are healthy, because that leads to a healthier environment in the rest of your body. So, let me finish up and give you a few moments to ask some questions. It seems like a silly cliche to say that if your mouth is healthy, the rest of your body is more likely to be healthy. What I wanted to leave you with in our 15 or 20 minutes or so today was an understanding of why that saying is true, why that's going to make sense. I want you to understand that bleeding gums are not healthy. We still today have people coming into our office in Plano, and when you ask them that question, they say, yes, they've always bled, my neighbors bleed, it's no big deal. I want you to understand why that is not so. I want you to understand that although you're told to floss daily and it's a pain in the neck, flossing daily prolongs your life and it improves the quality of your life. So I assume that people are here because they're interested. This is a wellness expo and we're all here because we're interested and we have a desire to understand how to accomplish these better. But flossing has a direct correlation between the quantity and quality of our life and the way that we choose to live it. We're in control of our oral health. You're in control of your oral health. People like me can help, but at the end of the day, it's something that you do day in and day out in your house, in your home, in the privacy of your own bedroom, in order to have control of that. And what I hope that we've accomplished here today is simply to give you a very brief outlook on what it is that makes that statement true. So I thank you for your time, and we'll be happy to take any questions that you have as a group. And as I said, I'll stick around after. Yes, ma'am.
Yes, I have a friend that has to root canal, and after that she started having a heart problem. What do you think about root canal?
The question is that she had a friend who had 2 root canals and after that started having heart problems, and what do I think of root canals? Root canals are an essential component of what we do. A root canal is simply the removal of infected tissue from the inside of the tooth, and I don't believe that infected tissue staying in the body is ever a good idea, because the body, by removing it, you give the body a better chance to heal. What I, of course, can't know what happened with your friend because I don't know the details there. But sometimes what we see happens is, again, you have this issue where, depending on the severity of the issue, blood-borne bacteria may have gotten into her body because of the process, as a part of the process. And if she was not placed on antibiotics as a part of that because it was an active infection, then perhaps the bacteria wasn't controlled at the time. Sir. No. You raised your hand.
Do you recommend any of the mouthwashes on the market today as a way of keeping down bacteria, or are they mostly useless?
I believe that they can serve a function. I don't believe that they serve as a substitute for mechanical removal. Listerine has the seal of approval from the American Dental Association. It does reduce the amount of bacteria in the mouth. I think that sometimes, and I'm as guilty of this as the next person, it's much easier for us to swish around something in our mouth than it is to spend 2 or 3 minutes brushing our teeth and flossing. But at the end of the day, the tried and true method, and I am somewhat conservative in this respect, shows that is the case where you get a better result by the mechanical means than you do with mouth rinses. But, they're better than nothing, and they do serve a useful purpose, and they can be somewhat successful. Okay.
What's your position on mercury fillings?
It's fascinating that you asked me that, and I won't take more than about 15 seconds, and we can continue this outside. I belong to, the world today is so interesting. I belong to an email network of dentists around the country. And one of the threads of the discussion that's been going for the last 3 or 4 days has been about just that topic. And it has been just the largest bone of contention among dentists who are on this network. So I will give you my opinion, and obviously everybody else has other opinions. I believe from the research that I have read, and I consider myself relatively current on that the amount of mercury that is released from the fillings that are in our mouths, and I have a mouthful, so I speak from that point, is so negligible that it is not a problem, that we get more mercury from the fish that we eat. There's plenty of research, and if you're that interested, we can carry this on offline. What I will say, however, because typically where that question then goes among our patients is, should I have my amalgam, my silver fillings removed? And my answer is that assuming that they are in perfectly healthy and functional shape, that I do not recommend removing them just for the sake of mercury issues. I happily remove silver fillings for aesthetic purposes all the time. There are mechanical reasons to do it, but mercury is not one of it. And I'll stop there and we can take it offline.
Am I understanding correctly that periodontal disease doesn't necessarily cause the malfunction like diabetes and heart disease, but if you have these problems, then one makes the other one worse?
That is exactly right. Periodontal disease is not a cause of these other functions. These functions are caused by other things, but they're all related. If you have periodontal disease, you are more likely to have problems elsewhere in your body. If you have problems elsewhere in your body, you are more likely to have periodontal disease. If you have problems elsewhere in the body and you solve the periodontal disease, you are removing one of the major inflammatory problems for the body and thereby allowing your body's inflammation response level, this host response issue that you may have read about, to settle down some and create less of a problem for some of these other disease states. I guess we have time for one more and then I'll...
Mine's just a crazy question, because my question is, say you have an inflammatory condition in your mouth, but it's not caused in your mouth. Somewhere. How does one find where the other problem is? If you don't have diabetes, and you don't have heart disease, and you don't have this, and you don't have that, where does that come from?
Well, I mean, how does one look for it? Well, that's what the whole issue of differential diagnosis is. You just, our job as professionals is to put together the right team of people to begin to make that all work for you. I'll give you a specific example of that, a purely coincidental level, and then I'll step down and make way for the next person's time. My college roommate, and this goes back many years ago, is married to a beautiful young woman who, well, we're not so young anymore, but she was at the time. And she was misdiagnosed. She was misdiagnosed with lupus, and in fact, it was not simply, but it turned out to be rheumatoid arthritis. But she had a raging amount of periodontal disease. She had significant bone loss going on at the time in her mouth, and it was because of what was going on in her mouth that they began to have to find out where else it was going on, because once they brought that under control, they had to find out what the cause of that was, since there was no obvious cause, and she was doing all the right things in her mouth. So our job is to find the right team of people to pull all that together and make that work for you.
So do you think when they tell you that stress causes these things, that's causing?
There's a great old book that's about 30 years old that talks about stress, good stress and bad stress, and I think that bad stress can cause it, but good stress does not, and one has to kind of work with people to figure out whether you've got good stress or bad stress. But there's a great book on that topic about 30 years old. All right. Thank you, folks. I appreciate your attention.